Thank you, Mr. Chairman. Appreciate that. And also this markup, including my bill, H.R. 5394, the Expanding Remote Monitoring Access Act. This amendment makes a minor technical adjustment to the bill to address comments we received from CMS. During the pandemic, I was introduced to remote patient monitoring when a hospital and an FQHC in my district showed me firsthand their successful RPM programs. These programs were made possible by a waiver that has since expired and which I believe needs to be reinstated. RPM empowers patients to better manage their chronic conditions while enabling healthcare providers to adjust treatment plans and promptly identify critical events from a distance in real time. This technology can reduce provider workload while giving them greater access to patient feedback and data to identify problems earlier. In rural communities like mine, where healthcare providers are scarce and patients often face challenges accessing traditional care facilities due to distance, these services are especially helpful. However, when the waivers expired, CMS went back to only paying for RPM when physicians receive at least 16 days worth of data per month. As our doctor colleagues on this committee will tell you, sometimes they need to be able to monitor their patients for a week, sometimes two. Cardiovascular patients, diabetics, and those with renal disease are just a few of those who can benefit from remote patient monitoring. But under CMS policy, these patients are left without access unless they give 16 days of monitoring data each month. Our bill follows the model Congress established for our own telehealth flexibilities. This bill extends for 2 years coverage of remote monitoring for patients who need at least 2 days of monitoring each month. This interim solution ensures patients receive the necessary care while Congress and CMS develop a comprehensive long-term plan. Patients will receive better care because they are empowered to personally manage their healthcare conditions. Medicare will see lower costs in the long run because these devices will catch catastrophic events earlier. We're already seeing the patient benefits and cost savings from expanded RPM use. A study by the University Hospitals in Ohio projected that remote monitoring could potentially lead to 87% fewer hospitalizations, 77% fewer deaths, and reduced per patient cost of over $11,000 compared to standard care. After equipping patients with RPM for 6 months, Ochsner Healthcare System found that 79 of their hypertensive patients achieved blood pressure control and 81% of enrolled type 2 diabetes patients met their blood sugar levels. The University of Alabama at Birmingham extended remote patient monitoring to 17,000 beneficiaries within the accountable care organization, including those with congestive heart failure, chronic kidney disease, diabetes, and hypertension, resulting in a savings of $1,300 per month per member. This markup is especially timely given the ongoing delays from the AMA, CPT panel, and inaction from the CMS in last summer's PFS rulemaking. Patients who have benefited from remote patient monitoring cannot wait any longer, and it is encouraging to see this subcommittee take action today to lead on increasing access to this critical care. I look forward to working to continue expanding access to these valuable technologies and encourage my colleagues to join me today in supporting this amendment and the underlying bill. Thank you, Mr. Chairman. I yield back.